We talk about discharge from the minute that you're admitted, from, a patient who, is walking in, has a quick treatment, turned around, goes home, or if it's a patient that's potentially coming in and looks like their admission might be long-term, might need some potential support in the community, etc. That means working with a lot of outside services, Carers Trust, New Kiss, local authority, packages of care. We come across loads of different multidisciplinaries which we all utilise to be able to support one patient in their journey from start to finish.
Ond dwi'n meddwl na y peth pwysica allan ni wneud ydy cynnig cymorth i ofalwyr, i teuluoedd, pan maen nhw mynd i ysbyty, neu yn yr ysbyty, neu eisiau ddod allan ysbyty. Does na neb eisiau bod yn stuck yn ysbyty yn hwyrach na dyn nhw'n gorfod. So mae'n bwysig bod ni'n gallu cynnig y gwasanaeth i gael nhw adra yn saff ac mewn ffordd sydd wedi ei gynllunio yn iawn.
If somebody's got a loved one in hospital, our facilitator will try to engage with them, either meet them on the wards, ring them up, talking to them about what their needs will be when they come out of hospital. If there's any issues that a carer reveals to us or they're worried about, we'll work with both the ward and the PALS team, and to be quite honest, we get some really, really fantastic results.
Kathy Friday was a terrific support. She was there when I had nobody else to turn to. Absolutely exceptional, especially when Sandra was being discharged. Had we got everything in place for the needs that we required, help get Sandra back home, and through her we managed to have carers coming in.
One of the big worries the carer has is just practically how you support someone at home, whether things just need to be taken out so that a hospital bed or proper facilities can be placed in, or sometimes we switch bedrooms, so bedrooms come down and other things go up. All the evidence shows that the person's going to get better at home rather than in hospital, but sometimes people are stuck because you just can't practically do those things. When someone is admitted into hospital, obviously all the attention is on that person. They're the one who is acutely unwell at that moment. Often the carer, it can be forgotten.
I had major surgery. I was run down. I was trying to do everything. And I realised you can't do everything. To our amazement, New Kiss had provided a food parcel. So they were the essentials, so I was very, very grateful for that.
In terms of our patient and carer experience team, we capture carer experiences through patient stories. We've got lots of great experiences about how they felt listened to and involved in the processes. Our carers organisations support carers and their patients really early on into the process. They'll visit them on the ward, they'll attend MDT meetings, and they'll very much be the voice to the patient. It's really important that the earliest opportunity we make those referrals.
Ydych chi'n gwybod, da ni'n gwybod yn aml iawn bod mynd i ysbyty i unrhyw un yn rhywbeth sydd yn eitha bryderus i bobl. A dwi'n meddwl bod yn bwysig bod ni yna i ofalwyr a'i teuluoedd i ddangos cefnogaeth a'r adega prysur iawn yn ei bywydau.
A lot of carers have got no support, don't know who to turn to.
I'm Tamara Gillis, I work as hospital outreach worker.
I do get unsafe discharges that they feel they've got no option but to take their cared for home, well, knowing that they are unable to cope. They have got no support, they just can't manage. What I would do is liaise with hospital staff and the ward and explain that the person would end up being admitted back into hospital because the carer is unable to manage and care without me helping them to provide the support and advice. They would be in crisis situation.
Firstly, we need to look through the eyes of the carer themselves to truly understand what people who are looking after their loved ones need. There is a danger, of course, in an acute setting. We only look at things through a clinical lens. I think it's accepted that there's some pinch points, and I think it's absolutely critical for care organisations to support that timely exit from treatment.
Ac sa bod rhywun yna i gynorthwyo paratoi bobl ddod allan, yr unig beth sgynna chi ydi bed blocking, a mae o yn cymryd mwy a mwy o amser i bobl mynd i mewn i ysbytai a dod allan o ysbyty. So dwi'n meddwl bod y gwaith da ni'n neud yn holl bwysig i wneud siŵr bod y ffordd mewn ag allan o wasanaethau yn bwysig.
I love my job. I love being able to support patients from front to back. My job is not easy by any means. I don't think anybody's is in healthcare at the moment. So it's probably now when we need services more than ever.
The Health Board have been a really strong partner. So they have worked with us to identify where the pressure points are and where the support is really needed.
Fundamentally, you want to make a difference. When someone needs us at their most vulnerable time in their life, that we're there for them.
You take on the role and you think that's it, you don't need anybody else. But we're a human after all, and you cannot do it alone.